Ladies and gentlemen, I only wish I could be with you in Ljubljana today in person, but I am grateful for the opportunity to address you all, even if I have to do so via the screen. First, let me applaud all of you in EUROPA DONNA for organizing this important event. Breasts are symbol of femininity and also maternity, so beautifully represented in Raphael's Nursing Madonna. It is with no doubt a terrible experience for any woman and your beloved ones. So thank you all for your commitment to fighting breast cancer and to improving the lives of women affected by this terrible disease. Today you are discussing best practices ranging from prevention to care. I am glad that the European Commission's approach is very much in line. Let me start with prevention and early identification of cancer, a cornerstone of our fight against cancer. The Commission promotes the European Code Against Cancer with its 12 messages to reduce cancer risks, such as not smoking, keeping a healthy weight, being active. Such initiatives, providing information in a citizen-friendly, easily understandable way, are essential to get the message across on how cancer risk can be reduced. I encourage you all to help us disseminate the Code's messages across Europe, seizing the opportunity of the Breast Cancer Awareness Month, this month. I note the great work done by the cancer leagues in this regard. Of course, cancer can strike the healthiest and fittest amongst us. We can't always prevent cancer, but we should be able to detect it and treat it at early stage. Active prophylaxis, screening, and early identification of breast cancer saves lives. The incidence of breast cancer is likely to rise in the European Union over the next decade. And that is why high quality and accessible breast cancer screening is more important than ever. Today, 26 European Union countries have population-based programs for breast cancer screening, and most member states follow the recommendations of the European guidelines. But more needs to be done to improve screening across the Union. Earlier this year, the Commission presented a report on breast cancer screening, which I hope you have all seen. It shows that concrete results have been achieved, but more efforts are needed. In this respect, the Commission's initiative on breast cancer seeks to ensure that high quality and reliable screening and follow-up are available to those in need. The initiative develops up-to-date evidence-based recommendations on screening, diagnosis, and care, and trustworthy guidelines. In this context, the Commission is also shaping the European Quality Assurance Scheme to label the quality of breast cancer control in breast centers and in hospitals. The entire initiative covers the whole patient cycle, from cancer screening to survivorship and palliative care. I want to take this opportunity to thank EUROPA DONNA for its essential contribution since the beginning of the initiative. Ladies and gentlemen, guidelines, recommendations, and best practices are very important, but they are just the beginning. Ladies and gentlemen, guidelines, recommendations, and best practices are very important, but they are just the beginning. The time has now come to put in practice these guidelines, recommendations, and best practices. We need to work together to implement concrete solutions to drive change and improvements on the ground. It is in this spirit that the Commission supports Member States in implementing best practices at national level through a number of instruments and programs. For example, a new joint action on cancer, funded under the Health Programme, is about to start. My aim with this action is to support Member States in implementing concrete measures on prevention, innovative treatments, survivorship, pain control, and optimization of resources for patient care. Let me conclude by thanking you for your commitment and for your continuing support. I look forward to further working with you. I wish you a successful and fruitful conference.